This module will explain peritoneal dialysis, one of the choices for kidney failure treatment. Peritoneal dialysis is a home-based dialysis choice. This means that you do this dialysis yourself in your own home. We are going to talk about what is peritoneal dialysis, or PD? How does peritoneal dialysis work? What are the benefits of peritoneal dialysis? And what are other things you need to think about regarding peritoneal dialysis? Peritoneal dialysis uses the inside lining of your own belly, all the black lines on this diagram, to clean the blood. This lining is called the peritoneum and acts like a natural filter, so the body is cleaned of the wastes and toxins inside the body. To do peritoneal dialysis, you need a small soft tube or catheter inserted into your belly. This can be done at the bedside, in the X-ray department, or in the operating room. It all depends on what your belly is like and what is available at your kidney center. To do peritoneal dialysis, a special liquid called dialysis solution, or dialysate, is put into your belly cavity through the PD catheter. Once the fluid is in the belly cavity, toxins and waste products are collected over the next few hours. The waste dialysis solution is then drained out of your body. This cycle, or peritoneal dialysis exchange, is repeated about 4 times per day: breakfast, lunch, supper, and bedtime. Each cycle, or exchange, takes about 30 minutes. You will be trained to do these exchanges. The training takes place at your dialysis center. The exchanges can be done at home, at work, on vacation, or when traveling. The exchanges are painless. The training for peritoneal dialysis usually takes about 5 to 7 days, but everyone has a different learning schedule. There are 2 types of peritoneal dialysis: the manual or twin bag method. It can also be called continuous ambulatory peritoneal dialysis, or CAPD. This is what we just talked about. For people who choose peritoneal dialysis, this method is usually the first method that is taught to a person with kidney failure. No machine is used. The exchanges are done by gravity alone. People usually do 4 exchanges per day. There is always fluid in the belly cavity. The second type of peritoneal dialysis is an automated or cycler method. This is also called continuous cycling peritoneal dialysis, or CCPD, or automated peritoneal dialysis, or APD. This type of peritoneal dialysis is done with a small machine overnight for about 8 to 10 hours while you are asleep. The dialysis solution stays in your belly cavity for short periods of time during the night before the machine drains it out and fills the belly with fresh dialysis solution. This is called the cycle. In the morning, before you get out of bed, one last fill will happen, and then you can disconnect yourself from the machine. The last fill will stay in your belly the whole day until you connect yourself to the machine again at night. Your kidney care team will help you decide which of the 2 types of peritoneal dialysis, manual or automated, is best for you. To do peritoneal dialysis at home, you will need a telephone to call your PD unit if needed. You will need a blood pressure cuff and digital scale to do your blood pressure and weight every day. You will need a clean work area and space to store the PD supplies that are delivered to your home free of charge. If you are on the automated peritoneal dialysis with the small machine, you will need electricity. If you have a companion animal, like a dog or cat, they cannot be in the room when you are doing your dialysis. This is because of the risk of infection. There is no cost for the dialysis supplies, the small dialysis machine, or the delivery of supplies to your home. Some of the benefits of peritoneal dialysis include being able to dialyze at home, being in control of your schedule so you can do more of the things you like to do, no need to travel to the dialysis unit several times per week, However, you still must attend the PD clinic appointments, but these are often only every 3 months. Whatever kidney function you have lasts longer when you are on peritoneal dialysis. This can have benefits for your overall health. No needles are used to perform peritoneal dialysis. Other benefits of peritoneal dialysis are: you can fit peritoneal dialysis into your lifestyle, and so PD can be done at work, at the lake, or on vacation. It is much easier to travel with PD. You may need to take fewer medications. There are fewer restrictions as to what you can eat or drink. Peritoneal dialysis is gentler on your body because it is closer to your natural kidney function. This is important, especially if you have heart problems too. There are some things you should consider when thinking about peritoneal dialysis. These include: PD needs to be done every day, so this will need to become part of your routine. You will need to have a catheter, or the soft tube put into your belly to do PD. Soaking in a bath or sitting in a hot tub cannot be done, as this could cause infection. Having showers is okay. You will need to have a space to store the PD supplies. Usually, a large closet will work. There is some chance of infection in the belly, but with training, this chance can be decreased. You may gain some weight, especially around the middle. In this module, we talked about peritoneal dialysis, what it is, how it works, the benefits of PD, and what other things you need to think about when deciding to do PD. If there is anything more you would like to know, please write down your questions and ask someone on your kidney care team.